that is there. Coagulated, they concentrate because in that sense, sometimes you might get a murmur. Mucus power is ready, mucus power is ready. So there is Baba, Mama, and Sakuri, Amma, Tata, Amma, that Jessica, right, ranked one last time. They are giving a better message. That's very important. One of the important message was she told, like, she didn't prefer illustrated or any other note or any other single book. That's what I'm telling you, right? Whenever you want to give under, whenever you want to keyword, that will be okay, right? You are rank one under.
Paediatrics the Easy.
Look at those videos. He has amazing classes on Viva, like spot on. Like it makes you think. It tells you why you're doing what you're doing. So and by the time you go for exams, you will be super confident. It showcases like I was really confident. I was not even scared of bits, and I know what I was doing.
For service practicals was history. You have to go through it. The mismatch practical, the short case practicals.
Study all the clinical examinations, what sir tells, and then just perform it. After following the theory and after going through all the clinical examinations step by step, I was able to still perform.
You can hear sir's voice in the back of your head during the long case guiding you.
What I did was listen to him very carefully. Whatever the things he teaches, like
nothing much to study, there's nothing to read. Just follow sir's notes and just follow what sir has to tell, and you go for all the classes regularly. Then these exams are not difficult at all.
Don't read unnecessary things. Just stick to sir's notes.
Because to conduct this sophisticated classes, like he used to do light patients.
Sir will guide you all very well in the short cases and the long cases. This is great advice. I mean, patient handling, the things and the things I don't know. There was a lot. But sir gave to me, and I used each and every one of them.
So we have to practice in front of you.
I need to thank Dr. Ruanga sir, because with sir, I had the personal opportunity to go and see all the cases. All the cases in the sense, CBS, more than 20 to 30 cases. CNS, or everything. In thalassemia unit, everything. Acromegaly, everything.
I went for sir's emergency line. So this previous exam, where I got the case that I got was status at and it was the same case that I got for my Viva in Japan.
All the questions you gave in class, word to word, those were the steps. Like in step by they asked all those questions.
I saw the patient from far and I told the diagnosis. Consultants were like shocked when I was like answering.
Sir will make you exceptionally good at it. Like sir made me like so much good at like everything I was doing. I was so confident in my exam.
And pediatrics is easy.
Right. Good evening, everyone. Can you all hear me? You can hear me, right? Great, excellent. So, good evening, everyone. I'm Dr. Ruanga. I think I think most of y'all know me very well. Actually, I don't need to give an introduction. So basically, right, I'm currently attached to Lady Ridge Hospital.
And so I've been doing this ERPM classes for 8 years so I started when I was a pre-intern, right? So then because the reason was that time I had the highest marks ever in history for each and every component separately, for the MCQs, the SBAs, the short cases, the long cases, everything. So I was so confident. So then I started when I was a pre-intern. Then I attached to SIPNA Institute when I was an RHO. Then after that, I've been continuing this. So I was able to continue this because I started this because the reason is like those days the pediatric had the highest failure rate. So most of students actually get most of students get failed in peds, right? So that was the most difficult subject. That is the most difficult subject. But I'm happy and proud that I was able to change the pattern. Now, of course, most of the years, the highest pass rate you seen in pediatrics. So it was initially improved in Viva, then gradually improved in theory as well. So I think that's more than enough about myself. So I think most of y'all know about me because most of y'all, I think almost all of you joined for my SBAtrix program before this theory course, right? Before this theory exam, right? This time theory exam. So you all are well aware about me. So you will be more impressed in Viva, right? Than the SBAtrix. So here the important message is, guys, what? So today it's very important because so first most important thing is you will get to know what is the plan, right? So what is the Viva course plan and everything, because how to get through the ERPM Viva easily, right? So it's not like theory, right? It's not like theory, how much you study, like sometimes even you study so much, sometimes still you can get failed in one component, right? So that's why it's very important to know how to get through the exams very easily, right? So here the important thing is just like as I'm telling you all previously also, Viva also not unknown and right? It's easy. You just need to follow the instructions and what I'm telling you all. So that would be more than enough. Then you will get through. So the most important thing is you need to have faith. So if you have faith, you will follow my instructions and you will do what because I have a lot of experience. I know what is necessary, right? So then if you follow my instructions, then definitely you will get through the exams. It is very hard to get failed in exams, right? So I will guarantee you will definitely get through the exams, and I will make sure that you will get through the exams if you follow my instructions. So there is no any other magic. So it's very easy, simple, right? Good. So here the important thing is then of course we will discuss about a little bit how the exam pattern and how it goes, as well as then finally we will discuss a little bit about CVS, right? So here the important thing is right. So first of all, you need to know, should have a basic idea about this ERPM Viva program. I think most of y'all are well aware about that. I don't need to explain much. So I'm quickly going through those things. So first of all, guys, regarding ERPM Viva. So right, can you all see? Okay. So here it's guys. So what is ERPM? So basically, it's a compulsory examination for registration to practice medicine in Sri Lanka for foreign qualified medical graduates to the health system in Sri Lanka, right? So it is very important that it's like an interview, right? So here the thing is, what is the purpose of conducting these ERPM exams? So to get very good house officers to the health system in Sri Lanka. So here it's very important. We don't want consultants, right? This is not the exam, like this is not part MD part 2. We don't want consultants. At the same time, we don't want, like, it's not an exam to like for nurses or attendants. So it's like an interview for house officers. So you need to know what is really necessary to become a good house officer. This is like an interview for house officer. So it's basically like if in the Viva is the main component which decides whether you are good enough to become a good house officer or not, right? So basically, guys, so what do they basically assess? So the first thing is they will assess your core knowledge in clinical facts related to common conditions in Sri Lankan hospital setup, right? So the little bit less common ones, of course, like we have assessed in your theory, right? Theory exams we have already assessed. But the Viva is always about the core knowledge about the common conditions, right? So in Sri Lankan hospital setup, so in your day-to-day life, what are the common conditions which you will see? So of course, the asthma, nephrotic, febrile convulsions, diarrhea, UTI, nephritic, meningitis, right? So then dengue, neonatal conditions, right? Those are the common conditions which you will see in your hospital setup. So we will frequently ask about those things, right? So in your long cases exams, 95% of the time, like you will get the cases which I mentioned right now, one out of that. So that is very easy. So there is nothing much to study actually, right? So it's very easy. So there will be only few topics, right? Like common 11 topics and little bit less common, like another 10 topics will be there, right? So if you have studied the main 11 long cases, there's a 95% chance is there to get one out of that, right? So then if you are not very unlucky, then you will get one out of that. So if you have go through this all 22 cases, right? 21 cases, then definitely you will not get anything else. So that's all what you will get, right? So it's not like theory, it's very easy. So you just need to know about these common conditions, right? That is it. So then, of course, you need to learn the clinical reasoning as well as critical thinking as well as the decision making, right? So basically the clinical reasoning and critical thinking we will assess mainly in your short cases, right? So here it's like this. So most of the time the students actually what they do, like what happens is like when they get some like a case, exam case, like sometimes we will give you the like for example, if you get like abdominal system examination, so after palpating the liver and after palpating spleen, then they will ask what is your most likely diagnosis. So most of the students used to say like they will say some differential diagnosis. So they will say they are telling like hemolytic anemia or something like infections, right? Sometimes malignancies, like that you will tell some differential diagnosis. But the problem is, guys, what? So that is not the answers what we expect. That is not about critical thinking. So it's very broad. So hemolytic anemia is a very broad term where even G6PD also comes under hemolytic anemia, where it doesn't, you don't see hepatosplenomegaly. But you tend to use those terms and the differential diagnosis because you have seen in these books as well as most of the teachers used to teach in such way because most of the books used to mention in such way. But the reality is we don't accept those answers. So what you need to do is like you need to follow the course and you need to learn what are the expectations of the examiners, and then it would be very easy. So nothing's gonna happen. So here the important thing is like it's a rational answer. So sometimes when we give a low limb examination, so sometimes students use after exam, it's a diplegic CP. So then we will ask, how do you know it is diplegic CP? So then they will not be able to rationalize the thing. So basically you need to know about this core knowledge, have a core knowledge regarding these common conditions, as well as you need to nicely tell your differential diagnosis in a rational way. So the third one is, guys, what the patient caring. So here the important thing is, guys, what? So in your exams, it's not like local faculty exams. It's a little bit different. So the long cases, of course, like the local grads, they are getting 40 minutes and they are supposed to do the complete history taken as well as the examination. And they are presenting after 40 minutes time. So they like the examiner will not be there, right? It's not observed history taken. But in y'all, of course, it's very different. So in y'all, of course, like it's an observed history taking where the examiners are just next to you. So they are listening what exactly you ask, right? So keep this in your mind. Your ERPM exam is very much more difficult compared to local faculty exams. That is the reality because examiners are next to you and you can't ask these just random questions. It should be in a very nice order as well, right? So it is very much difficult and you need lot of training, right? So that is extremely important. So at the same time, why they have changed this exam pattern. So like they for your long cases, they will be an observe history taking. So the main reason is, guys, what? So you might be wondering what is the reason? So the reason is because the local grads, of course, they will be like practicing. They are coming for the local hospitals for the clinicals, and the consultants are keep on assessing them. So they know they are teaching about the attitudes and everything. But sometimes I don't. It's not nice to say, but actually we need to come to the real. We need to say the reality. Some actually believe that these foreign graduates sometimes they have less care towards patients. That is a common myth among most of these consultants. So because of that, they actually expect y'all, right? They actually want y'all to do these examination as well as history taking part in a very decent, nice method, right? So they like more than the knowledge, they will be like some senior consultants, they will be mainly assessing your patient caring and how you talk, how nicely you are talking. Like those things will be mainly assessed. So the local vets, of course, the examiner will not be there next to them. So they can ask whatever they want, as well as they can do whatever they want. But for y'all, of course, it's not like that. It should be in a very nice way. So you need to approach, you need to ask an open-ended questions initially, then gradually go in low close-ended. Then of course you show that how much you care. Right? There's a separate pattern. So just going through these history-taking templates will not help you at all, right? So this is a separate art. It's a separate pattern. That's the reason. One of the main reasons so students get failed, because they don't know about this art, right? They haven't practiced with that they haven't practiced according to the proper art. That is the main reason they get failed in the exam. So it's very easy, right? So here the important message is, guys, so basically ERP structure. I'll brief you about ERP structure. I think you all are well aware. So the Viva, of course, there are two components are there, Part B and Part C. So the medical track you need to face for the medicine as well as the pediatric. So the pediatrics, you will get long cases as well as short cases for Part B. The long cases, you will get 20 minutes. So the basically 10 minutes for the history taking as well as the 10 minutes for the discussion, right? So the short cases, you will get 2 cases. So 7 minutes for the examination as well as the 3 minutes for the presentation and the discussion. But you will get two cases. So overall, you like it. The short cases also, it will be 20 minutes. So then of course the Part C again, it's a combined thing where you will learn gradually like what is exactly happening. And medical track, you will get a medicine emergency as well as the pediatric emergency. So most of the time they will provide some these randomly they will select a case or they will ask you to pick a slot. So then randomly they are given a case and you need to tell the exact management. So here the important thing is sometimes they don't ask just only one emergency. They might ask several emergencies, maybe 4 or 5 pediatric emergencies. So you need to be perfect in each and every component, right? So the emergencies are very important because just in case if you get failed in the exams, right, Part C, still you will not be able to get into your next time internship. So here the important thing is, guys, the pediatric exam structure. So the Part B, of course, you have long cases, you have short cases. So basically long cases, you need to score more than 45, as well as short cases, you need to score more than, again, 45%. But average overall, you need to score more than 50%. That is the theoretical rule. But when it comes to the practical setup, the important message is, guys, what? So most of the time, these students, but if you have scored very well in long cases, so even you have performed poor in short cases, sometimes they you can compensate, right? Even though we theoretically say long cases, you need to separately score 45, short cases separately 45. even if you scored like around like 40, 35, still if you have scored very high marks in your long cases around 90, 80, like something like that, most of the time you will get through the exam. So it is very important that you get mastered in the exams in each and every component, because accidentally sometimes you might screwed up in one short case, right? So that is sometimes possible with the stress and with the situation, with the like the pay, like depends on the patient, right? Sometimes, but still you will be able to compensate, because with the other short case as well as your long cases. So that is very important, because you will not get failed in the exams if you learn the things in like if you have got mastered in at least in one component. So most of the times the students who get failed in the exams, actually they have scored very less marks in all three components. That is the reason, right? So that is what we see in majority, right? Almost everyone. So that is about these pediatric exam structure. So what is common myths related to ERPM exams? So guys, right. So the most of the time, these students used to say that part B and C exams are very difficult, right? So that is a very, very common myth, right? So the reality is, guys, well, it's extremely easy, right? So these are extremely easy. So extremely easy, right? So keep that in your mind. So, and the most of the time, so you all are believing that you all are weak in clinicals because you had less clinical exposure during your faculty time. Guys, again, that is a very common, right, myth related to the ERPM exams. No, it's not about clinicals. Like the exposure you are getting is very much more compared to local grads, as well as it is not the reason to get failed in the exams, right? If you have very good theory knowledge and if you can apply these things in a very rational way, you will definitely get through the exams. So the best example is during the COVID pandemic time. Some students actually, like, they were scared about these COVID and they didn't join any of these practicals, right? Even though we conduct. So the thing is, like, during the COVID pandemic time, most of the students, right, got through the exams in very first shot, right? And if like most of students, a significant number of students are there, they haven't gone for a single hospital visit as well as for a single practical. Still, they were able to score very high marks in the Viva and they were able to get good ranks, right? So don't believe that you're like the reason like you all are getting low marks is due to lack of clinical exposure. It's mainly about the lack of theory knowledge related to Viva, right? That is the main reason. So make sure you get a very good theory proper base related to Viva. That would be more than enough to get through the exams easily. So then the other problem is, guys, that the students actually, after the exams, once the results are out, they keep on telling like students get failed because they were unlucky during the exams or the examiners were very tough, right? Examiners were very tough. The exams are like you were unlucky. The patients were not cooperative, right? They are telling hundreds of excuses, right? So the reality is, guys, what those are just like right? Those are just excuses. So here the reality is the examiners are really nice. They always want to pass you all, as well as these the other facts also, like just like they are just excuses. So here the important thing is best example is, guys, one. So those who have joined for my courses, right? And if they have followed my instructions, like especially if they have joined for my long cases exams, and if they have scored like adequate marks, right? Definitely they will definitely get through the ERPM Viva, right? එහෙම fail වෙච්ච එක ළමෙක්වත් නැහැ. So last time, those who followed my instructions, the pass rate was 100%. So there were very few students who got failed. Actually, the reason was they were hiding, and they didn't join any of these long cases exams, as well as they never practiced even a single case like through these online sessions. So that is the main reason and they were keep on hiding. So those who have joined, so 95% of the students have like followed my instructions very clear properly. So they all got through the exam, right? So there's now no other magic, right? So nothing, right? So like you might get failed in gyn obs, you might get failed in medicine, you might get failed in surgery, right? But it will, I don't know, right? So some students, but you will never ever get failed in PEDS, right? If you follow these very simple instructions, right? So have faith. If just that's the important message which I want you all to give. So here the important thing is, guys, what? Before moving to why students get failed in the exams, right? So I will tell you. So the why students get failed in the exams? Why students la fail in exam? What is the reason? What do you think? There's only two reasons. What is it? Very simple. So the one thing is, guys, what? Learning, like the lack of proper theory knowledge related to Viva. So if you have lack of proper theory knowledge related to Viva, so then you will not get through the exam. That is the main reason. So if you have learned the things right very correctly, so you will never get failed in the exam, right? So they won't ask anything. I will challenge all. මගේ එක ස්ටුඩන්ට් කෙනෙක් හරි කිව්වොත් මම උගන්නපු නැති ක්වෙස්චන් එකක් වයිවය කියලා ඇහුවා කියලා I will refund the money. That will never happen. Everything will be like what I have taught you, right? So the first thing is like lack of proper theory knowledge related to Viva. Viva එකේදී අහන දේවල් වලට අදාළ theory knowledge එක නැත්තම් you will get failed. So there are expectations are there. So the thing is you need to give a very rational answers. If you have given the rational answer, yes, you will get through the exam. Right? So most of the time, 95% of the students who have got failed, right? In ERP more, or if you go through the list, that is the reason. Yes, I told you, like they were like seven students were there, right? Who got failed in my last time Viva. මගේ මොනවට හරි course එකකට join වෙලා හැබැයි fail වෙලා තියෙන හතක් විතර ඉන්නවා. So what was the reason? Now they have learned like some students actually majority like out of that also like 4 haven't joined my long cases, right? But there were 3 students there who joined my long cases as well as these short cases, but still have got paid. What is the reason? That is also like possible. That is the thing is sometimes some students are there. They are very smart, born. They can talk very nicely. So once they learn the things in a very rational way, so they can express the knowledge in front of the examiner very easily, right? Tuck, galakina. But some students are there, even they have gained a very good knowledge, still they are unable to express that properly, right? So that is the reason. So if you have gained the knowledge and so that is the reason. So some students are there, they just get stuck and they are unable to express the knowledge by them. So basically they are not talking much, right? So as a house officer, මට ඕනේ කොයි වගේ doctor කෙනෙක්ද? For example, if I want for my house office, මොන වගේ කෙනෙක්ද ඕනේ? මට house officer චොරෙක් කෙනෙක් හිටියොත් මොකද වෙන්නේ? What will happen? So I will not be able to sleep all overnight. I will get හැමදාම රත් වෙලා තමයි ඉන්නේ පුපුර ඉන්නේ ward round එකේ. Because of the house officer. හැමදාම මගේ ලේ රත් කරගන්න ඕනේ? No, I don't want to do that. So I want to have a very calm and quiet ward, right? And right, house officer is the base, like he's the base of the ward, right? So he's the one, he's the first contact of the patient, and he's the one who is like staying all over the night, and he's the main person who is managing the ward actually, right? Consultant is doing only the decision making, right? So he's the HO is the one who's like handling everything, right? So here we want a good house officer. Then ඔයා හිතන්න මම කැමති house officer කෙනෙක් මෙලෝ දෙයක් දන්නේ නැහැ. nephrotic ළමෙක් යවනවා investigations කොහෙටවත් නැති ඒවා. අනිත් දවසේදී මේ භාගයක් යවලා UFR එකක් යවලා full blood count එකක් යවලා කොහෙදවත් නැති blood pitch එකක් යවලා C3 C4 එකක් යවලා බර ගානක් තියෙන එකක්, something like that you might say. So next day morning ward round, if I ask, for example, nephritic child, nephrotic. If I ask what is the albumin level, සර් ගිමින් යවන්න බැරි වුණා. So ආයෙ ගිහිල්ලා ළමයාව prick කරන්න ඕනේ. Again and again and again and again you need to prick. So do I want such a house officer? So those who have a very poor knowledge? No. Exam එක pass කරලා ඒ වගේ ළමයි ගිහිල්ලා වැඩ කරන තැන consultant ඊට පස්සේ මොකද කරන්නේ? pass කරපුවා exam එකේ අම්මාගේ තාත්තාගේ මතක් කර කර ඉන්න එක තමයි කරන්නේ. So that is what happens. Right? You don't want such house officers. Simple as that. Then do I want a house officer like still have average knowledge, but in the ward during the ward round when presenting this child came with fever for 3 days and cough and lungs were clear. I couldn't examine it, the throat. It was difficult. Child was not cooperative. Child was crying. I couldn't examine. මට ඕනේ එහෙම ගොත ගහන ළමෙක් හරි මොනවා වැඩ බෑ කියන ළමෙක්. Like such a house officer. I want smart house officer, right? Good morning, sir. This patient is a 3-year-old child. Currently, we are managing as lower respiratory tract infection, where the child came with an fever for 3 days as well as cough for 4 days. And now we have started IV ampicillin, right? And now CRP was 138 with the WBC to 23,000 with a neutrophil predominance. But currently, after day 2 of IV antibiotics, now the fever has been starts settling. Now child is febrile for the last 12 hours. Child's active feeding and urine output is fine, as well as the cough also has been reduced, and the lungs are almost getting cleared. Now currently I thought of continuing the antibiotics and observe for I will continue the monitoring. Simple summary, right? So pata gala smart කියන HO කෙනෙක් ඕනේ. මට ඕනේද අර වගේ HO කෙනෙක්. So here the Viva program is not about just like teaching all these, like going through these things. So first of all, you need to learn the concepts very clearly, right? So you need to get the very good knowledge about these facts. So that's why you need to use this platform and get the knowledge. The second important thing is, guys, what you need to again second important thing is you need to practice mainly the long cases. So then of course you will get through the exams easy, right? So here the important thing is, guys, what? So we are like short cases, like I have asked you all to join and cover first, because since we can start the practicals early, as well as you can go to hospitals and practice those things. But at the same time, we are doing these long cases also parallel. Why? The reason is you need to have a lot of practice for this as well. Because what we have practically seen is most of the students who have got failed in the exams, actually, they have scored, like those who have got failed in the exams, they have almost always, they have definitely got failed in long cases. Make a fail velamai. Plus or minus short case. Fail වෙච්ච ළමයි එක්ක මේක විතරක් හොඳටම අඩුයි නැත්නම් මේකයි දෙකක් fail. මේ isolated short cases failure students are less comparatively less. දෙකම එක්ක fail වෙලා. That is the reality. So long cases, we can assess your knowledge. If you have scored very high marks in long cases, you will definitely. That's why the long cases exams, I'm telling students, ඔයගොල්ලෝ මේ exam එකට ඇවිල්ලා 60ට වඩා ලකුණු ගත්තොත් අනිවාර්යෙන් මොන case එක exam එකේ ආවත්, මොන long case එක exam එකේ ආවත්, මොන short case එක exam එකේ ආවත්, මගේ long case exam එකේ 60ට වඩා ගත්තොත් still definitely you will get through the exam. Sure. No doubt. So like for the last 4-5 years, that was the same, right? One got failed. Even if you have scored more than 50, right, it passed, right? Those who have scored less than 45 only have a risk, right? They have a risk, right? So what I basically do is, like, I try to improve them. If I think those students are extremely poor, I use my previous bright students to make them like more smart, right? As well, right? Sometimes I like they individual attention and everything. So somehow I will make sure none of my students get failed in the exams if they don't hide, right? Samara message dana putawa practice කරන්න මේකට join වෙන්න මේකලා මම මේක තියෙනවා free sessions තියෙනවා like almost every day I will be discussing like for a week 3 5 6 times I will be discussing these long cases right whenever I get free so try to join those things as much as possible right so I am telling this but some students unfortunately they are hiding so can't help so I think I talked enough I think we'll share some experience, right, about some few students how they got through the exams easily. So, anyone is there? Chatuni, are you there?
Yes, sir. Can you hear me?
Yeah. Yes, Chatuni. Yes. This is Chatuni. Yes, Chatuni. Why don't you give I think you're one of the best person to tell about how you got through the exams as well as how you like. Got so much smart in PH, right? You were very smart, right? You had very high marks in my long case exams also, as well as I was very you you were I like when I went through these videos and practicals, you were always next to me as well, right? So so tell me, about tell me a little bit about you as well as how you got through the exams.
Okay, sir. Well, my name is Chatuni Kavin, and I'm a graduate from the Latin American Medical School in Cuba. And for those of you guys who are preparing for the Viva, from my experience in the Viva, what sir is saying about that basic theory knowledge is very important, guys. And because if you know, like in every single case, there are things that they will expect you to know in the Viva. And those are almost all the things that are covered in sir's theory and Viva lectures. Because you might think sometimes that theory and Viva is separate. I don't need my theory knowledge for the Viva, but that's not like it. What they check in your theory exam, especially in the SBA questions, is how you make decisions as a house officer. So it's very important for your Viva as well, because that's what they check in the practicals as well. What will you do if you get a patient as a house officer? So it's very important to have that basic theory knowledge and complement your Viva exam preparation with your theory. Also, the second thing I would tell you is please don't get stressed. Don't get scared, because PEDS patients, they can be scary for us, because we might think, what if I can't handle the child? What if they don't cooperate? What if they cry? You can get over those things. If you don't panic and if you think rationally at the moment, you can get over those things. And as long as you don't miss any obvious findings, the examiners will help you. They might tell you, go and examine the thaler again, go and examine this again. They might help you. Also, if you don't know something, like it can happen. You can forget things you know in the exam. You can get stressed in the moment. Don't linger there. Just tell them, okay, ma'am, I'm not sure. But they will ask you a different question. But if you stay there and if you linger, you will just lose your time and you won't be able to answer any of the questions. And the fourth thing is mainly, like sir said, for those long case discussions, especially, I encourage you to participate in as many as possible. You might not be able to perform in all those exams and practice sessions, but you need to participate. You need to see how the others are asking questions. You need to see what they are missing. You need to learn from each other's mistakes. So that was very helpful for me, especially in the long cases, because the more you listen, the more you get the flow. You can get to the point that you can guess what they're going to ask you next. So it's very important to join to those practice sessions and listen to other discussions, because that will help you, that will add to your experience. And also when it comes to short cases, it's mostly go through all the main short cases, and you should know the key findings you are looking for. You might not be able to identify the exact murmur, but you need to tell them, I think it's this murmur and this is why I think so. So as long as you can explain rationally why you think this way, and you can provide good differential, and you can let them know how I will differentiate these things, So that will be enough to get through the exam.
Great. So Chatuni, like she's the last time rank 1 student, and she she was very smart. Like you went to Cuba, no? For probably for, like you got a scholarship. Probably uh, she must be very bright. So the important thing is like her rank is she got rank 1 not because of me, right? It is because of her, right? So she's smart. She was very smart. I guided for the pediatrics. That's all, right? But I'm happy about her. That's all, right? Because I can't get the full credit, no. So because there were so many subjects there, and right there, right, and the theory, everything is there. But I'm very happy there because since she followed my instructions very clearly, and she was always next to me, right, in these Viva programs, right. So I'm really happy. And I noticed during the long case exams also, like she performed extremely well and she had a very good mark. And that time I realized like how smart she is. So, and currently you're working at teaching hospital Anuradhapura, am I correct?
Yes.
Your hometown is close to that, no? Kurunagala.
Yes,
Yes.
somewhat close.
Yes. So I'm really happy and glad. So thank you. I know you must be very busy today, right? With these evening ward rounds and everything. And thank you very much, Chatuni, for sharing your experiences. So wishing you all the best for a bright future. So then, thank you, Chatu. Yes. Anyone else like to share their experience?
So, Nitya.
Oh, yes, Nitya. Yes, of course. Yes. Hi, Nitya. Yes. How are you?
Yeah, I'm good. Hi, everyone. I'm Nitya. I was ranked second in PM, and I'm from Chittagong Medical College, Bangladesh. Hope you can hear me. Sir, can you hear me?
Yes, very clearly, Nitya.
So, I'm doing my internship in TH Anuradhapura. I selected Gene Ops for the first appointment, and I got to know Sir from Paediatrics. But then I thought that I missed the chance of doing his theory classes because it was too late for me to join for theory. But I did his Paediatrics, and then I did his topic wise. And also, I didn't do his most recent because his topic wise was more than enough. And then for the Viva, what I felt was I did all his short case, long case, and all the classes first before doing medicine, surgery, gene ops, everything. I did pediatrics. I fully finished pediatrics, and then it helped me for all the subjects. I mean, Chatuni mostly spoke about all the long case, short case, the techniques and everything. But what I felt was not only for pediatrics, but for medicine, surgery, and ops, sir's history format is really good. Because as my second language is Sinhala, but I didn't Sinhala because I did my exam in NHSL. So Sir gave all the templates. So it was helpful for me to take history for other subjects as well, because it's the same history format. And all the main cases, he gives a list of main cases. Those we should have them in the fingertips. So, and other than that, there will be second line cases and third line cases. So in some stations, y'all might get those as well, but y'all should be, so clear with the first line cases. And short cases, mostly pediatrics, I got a CVS case and a respiratory case, and both were very common cases. So you should be very clear with the common ones before going deep into the rare ones. So better to master in the common ones. And other than that, obey Sir's, what Sir says and what Sir asks us to do. Sir asked us to discuss, on the phone calls. I have discussed a few long cases and I have gone to LRH to practice short cases as well. And then I did his mass mixed practicals, and also I did his long case practicals as well. And it was really helpful because Sir will give every minute things. From minute tip points and tips and everything, he will, guide us. So it will be really helpful. And even during the LRH station, all the professors were very happy with my answers. The long case, especially, they said that I missed only 1 point. If not, they would have given me a really good mark. So it's all because of Sir, because Sir gave, answers for everything. And I didn't refer a single extra book or anything. I just read Sir's notes and then I went through it again.
That is again very important, right? That is again very important. By reading like unnecessary, like too many books and these notes will make more harm than the good, right? So
yes, because there are so many local books as well for, Viva, but it's better only to read Sir's notes, but go through it again and again. Even if you finish once, then start again from the beginning and read again. So once you go to the exam, just read the whole thing. Just go through the whole book before the exam and then go. So it will be really helpful. Other than that, the examination skills, they will just look at the techniques. Other than the, even if you say something wrong, you should be logical about it. So you should be logical that you should give a logical explanation for that. Even if it's wrong, they won't mind because we are not experts, right? Because we are students. So they will ask a logical explanation for that. So you should be prepared for that. Just don't start blabbering on the start of the exam itself so that you won't have a logical explanation for that. Then they will be disappointed and they will give less marks.
Yes. That is again very important, guys, because like it's always about rational answering, right? So just like telling these, like for example, if you get an febrile convulsion condition, so if you say like most of students comes and say finally that what is your diagnosis, they use say febrile convulsion. Right? So we will not like give much marks. So you need to be smart to give a very complete answers very rationally, right? So then if you say something like, sir, this is the second episode of complex febrile convulsion following acute invasive diarrhea. So you need to tell something a very complete answer, just asthma, just nephrotic, right? So there will be a comparison always. ඔයාට කලින් යන එක්කෙනා මරුවට කරලා ඊළඟ එක්කෙනාව දැක්කම ඉතින් අර පට ගාලා answers දීලා ඊළඟ එක්කෙනා, it's not like theory, right? It's always there will be a comparison. So that's why some students get scolded. So the previous students must have like performed extremely tuck. So then yes. So I think I like allowed you to come for these some extra, like because like she came several times for the LRS, because one thing is I invited Nitya Monday. The reason is I was not sure about some students whether they will perform well or not during these LRH sessions. So then of course I also can get angry and I also can get depressed. So I wanted Nitya to come because I knew that she will give the answers very perfectly, so that I will not get like depressed, right? So like because she was smart from the beginning and she was following my instructions and she was one of my very favorite students. So that's why like it's very important, right? So she actually like it's very important, like she followed the instructions very clearly, and I noticed that from the beginning. That's why I'm telling you all. So thank you very much, Nitya. I think you also must be very busy, right? So thank you for joining and sharing your experiences. So then, thank you and wishing you all the best.
Thanks, sir.
Anyone else who would like to share their experiences?
Hello, sir.
Who's this?
Hello, sir.
Yeah.
Anantri.
Yes. Yes.
Yes, sir.
Yeah. Give a small brief introduction as well as brief about the Viva thing.
I'm Anantri Lenage from Coast State Medical University. I ranked 3 in the merit list, and now I'm doing internship in BHLPT. These days I'm doing surgery, and next appointment is pediatrics. I got to know about sir from the Paediatrics, and
I want to stop there. So here what is the important message? So all these first 3, like almost everyone used to say like my first appointment is Dinam and the second appointment is pediatrics or something. Like almost everyone will say like they are doing peds. What is the reason? May keep this in your mind, whether you like it or not. Almost everyone of you foreign graduates have to do pediatrics. right? So you need to have very, very, very good knowledge in peds, right? Do you like the internship is not easy? So do you want like the most of the time some students used to say, "Ane internship is like you all are not aware. You all are seeing only the FB post and everything and the Instagram post. The reality is different, right? Because all are talking to me, you know. So most of the students are suffering, suffering, suffering. Some are leaving internship, like right. So it's not easy. ඒගොල්ලෝ ගිහිල්ලා අර සමය හැබැයි ඇත්ත කතා වෙනස්. So here the important thing is, look, if you have very good knowledge, right, it's not about only the knowledge. So it's about the things which you learn in Viva. So you learn the theory knowledge related to Viva, related to these common conditions, as well as the skills for the communication. If you have both of those things, then of course you can have very peaceful internship, right? So this is like we are basically doing a training for an house officer, right? So if you learn those things, if you can express your knowledge very clearly, and if you can present nicely, if you are very good in communication with others, like other colleagues, like other staff members, then of course you can have very happy and nice time. So my experience is like the internship is the time where I enjoyed maximum, as well as right, I learn maximum also, as well as at the same time that is the time where I earn maximum also, right? So it's like, so here the thing is, I used to continue these classes when I was doing internship, right? Because I was able to balance everything, because like I didn't have to like prepare for anything, because since my knowledge was so super. And my consultants always used to say, consultants, they were seeing 3 senior registrars and 3 final year registrars, as well as emergency registrar, these nutrition registrars, all used to say, මෙයාව නම් ward round ගෙනියන්න බෑ. කට lock කරලා ගෙනියන්න ඕනේ. Why? The consultant used to ask questions, අහනවා මෙයාගෙන් අහනවා මෙයා කවුරුත් දන්නේ all the time, like then the house officer is the one who's giving the answers, right? So that was very like still, like for all the parties, still like after so many years, still they used to invite me, right? Consultants, like everyone used to, because the thing is they are in their mind that the who was like, they are always used to say like මට හම්බෙලා තියෙන best house office. So මටත් මගේ ඔළුවේ තියෙනවා මේකේ හිටපු house මේ house office තමයි මගේ හොඳම. මෙයා දෙක. මේ ආය නම් චොරම. So if you learn these things, if you go through this Viva program, and you will have that confidence and everything, and you will knowledge as well as the communication skills, and you can have very good internship, as well as like the pediatrics you need to learn more than anything, right? Okay, I'm sorry for this, right? So, yes, you can continue.
I got to know, sir, from Paediatrics. As Anita told, I'm also really sad I couldn't join the theory session from sir. What sir teaches more than enough to pass the exam, if you can remember. Always practice. That is the most important thing, because the presentation is really important, because that is what we can impress about from the beginning. From the beginning we can impress. It's never matter you go to hospital or not, if you study the notes from the sir, and if you have to practice. I have practiced, and
very good example. How many times you came for these LRH sessions?
I have never.
It's not real necessary, right? Some students are keep thinking like LRH එකට ආපුවම I can like there is a magic. There are so many programs are there like which are very much important than that. So even if you come to LRH, I will like there will be like several students, and I might be able to examine, like I might be able to assess only one case, short case or something. Other than that, I will not be able to individually assess all these systems and all these long cases. No, only one short case. You can see how the others are doing. So the coming to LRH will not make like, yeah, I'm doing these practicals. But again, that is a common myth, right? So some students believe long case exams. If I come to LRH, no, there's nothing such. She didn't join any of these LRH sessions. And yes, very good. Yes.
I didn't go to hospitals for practice pediatrics. I went to hospitals for study and practice for the surgery and gynecology, but not to practice pediatrics. I have practiced pediatrics from SL's notes only. The short case which I got was ASD, but I haven't never examined the ASD child before. But less than 1 minute, I got to the ASD, and I was really good with the presentation, and they were impressed. And the lateral sections are same as the note, so it was really easy. The other short case was the neurology short case, and as we know, the neurology short case, they said to check the lower limbs, but from the person who studies from the sir, we have to examine those six or seven components, not only to examine the lower limb. Then they were impressed, like, oh my god, you did all those, like, that's the that's why I think, because I haven't examined, I went to the practicals of that CP children and the
Very
mass
good.
mix
Give me a
practicals,
second.
but
Give
I
me a
did.
second, Anutri. So here there is another important message. What is it? Like the in the mass mix practical and some other practicals, oh, there were murmurs there. My like VSD is so many murmurs are there, but maybe like Anutri was unable to examine ASD. But here the most important message is, guys, what? So in your exams, ඔගලගේ exam එක ඉවර වෙලා ආපු senior කෙනෙක් කවදා හරි කියලා ඇහිලා තියෙනවද? I couldn't hear the murmur. I couldn't get the spleen. I couldn't get the liver. Have you ever heard? No, because we are giving very, very prominent murmurs. පාරේ right වීරියේ අලියෙක්ට උනත් ඇහෙන එකක් වගේ එකක් තියෙන්නේ, right? Any person can hear the murmur. The liver, very prominent. If there's a liver, you will be able to definitely ඕනෙම මනුස්සෙන්ට අහු වෙනවා නිකන් බඩටත් තිබ්බත්. Spleen also same. So we are giving cases like such cases. භාගයට අහු වෙනවද නැද්ද? අහු වෙනවද නැද්ද නම් නැහැ. ඒක ස්ප්ලීන් එකක්. කව liver එක. Right? So like we are giving very obvious things. Yeah, anyone could. The why students sometimes get screwed up in short is because of not telling these answers rationally and in a smart way. So that is the reason. So if you learn these theory components clearly, so that would be enough to like because I have taught very important tricks. CVS, how to like narrow down these things, how to like identify ASD out. So if you have very solid knowledge, so it's easy, nothing. So you will definitely get through the exams. Yes, Anut, you can continue. Sorry.
Yes, that's all. You have only to practice the what sir says, not from any extra book or extra note. You can definitely pass with a good rank. With what? Thank you.
Yes, thank you very much, Anutri. So she again like one of my favorite student, good student, and thank you very much. And she's from Kursk, and thanks for joining, Anutri, and wishing you all the best for a bright future. Good, thank you. So I don't think it take much time now. Are there any more students out there to share like in a different aspect? Anyone else? Right? Is that all? Yumandi, are you there? Okay, right. So I think right. So great. I think you heard that would be right. You heard most of these experiences, right? So I think that would be. Give me a second, guys. Right. Okay. Right. Okay. Right. So okay, guys. So we will continue. So some students actually like they said they wanted to share their experiences, but at the same time, like they sometimes they get busy, like they are doing the internship and everything. So, okay, right. So we'll continue. So here the important message is, guys, what? So the ERPM exam. So how to pass the ERPM exams again, right? So it's nothing much. So basically, you need to learn. There are two things are there. What are the two things? First thing is you need to learn these theory facts in a very rational way. That is the most important thing. So if you have learned those things, that would be more than enough. But there are some students are there, they are not very good in communicating with others. So, right? So then of course, like you need to, some students are not aware like about their weakness. So that's why at least practice at least once in front of me, right? So that is extremely important. So here the important thing is like you can practice again and again and again and again. You will get enough chances because like almost every day I will be discussing, right? I will be putting a message, so you all can join, right? And these online sessions. So the whenever I get free, I put a message in my these WhatsApp groups. So then of course you can join, and I'm conducting these sessions. So most of the time in the morning hours as well as sometimes in the evening hours, I will conduct. So almost every day, like there will be two sessions. So more you join, more you learn. So here the thing is, it is very important. So when you keep on practicing, then you will learn your mistakes as well as you will learn the pattern and the art of the other students, and right then you can get perfect. So that's how it right. So that's what you need to do basically. So if you do those two things, you will definitely get through the exams. So here the important thing is, guys, that I will brief about these the plan, the what is the course plan and everything. So here the thing is, give me a second. Right. So here the important thing is, guys, what? Can you all see the screen? Right. So okay, right. So here the pediatrics Viva course plan. Basically, like I'll be training you all for short cases, long cases, as well as the emergencies, mainly the pediatrics. So then, guys, short cases. So short cases, there are several important things are there. So here the important thing is, guys, what I don't want you all like to sometimes don't compare with other subjects because like the different teachers has different methods, right? Right? මම ගිහිල්ලා එකපාරම ගිහිල්ලා ඔහේ randomly නිකන් ගිහිල්ලා ලෙඩ්ඩු අල්ලන්න නිකන් අරහෙන් මෙරිකනවා right? I don't like that. So it should be a very proper organized way. So if you learn the facts like try to cover the things early as possible, so then we can initiate these practical sessions early. So regarding short cases, there are 5 things are there. So the first one is online lectures. Where that is the most important thing, where you need to get a proper knowledge, right? So the first of all, like the CVS, you need to cover the CVS and CNS first. CVS again, don't think that is very easy, right? So it is not easy. By CVS, by CVS, like okay. Before that, I will tell you like short cases. So short cases, what happens is, guys, what in your exams, short cases, what are short cases you get in your exams? Patum, what do you think? Monad Oglant, any short cases?
For PEDS, sir?
Yes.
Of course, you have the CVS case,
Yes.
which you can get all the murmurs and all that. Then the neuro, CNS.
CNS, yes.
GI you can get, and RS.
Yeah. GI, abdominal examination, yes. Then?
Respiratory.
Respiratory.
And of course,
Sorry? I didn't hear you properly. Sorry?
That
The connection is not so good. What is it?
Yeah. Neonatal, sir. I typed you on the chat.
Neonatal?
So give me a second. I need to figure out my. Can you give me?
Right. So basically, for medicine, of course, you are getting these four, right? CVS, CNS, abdomen, and respiratory. But the pediatrics, it's not like that. Not only those four, you will get development, right? Development, then these neonatal examination, as well as miscellaneous cases. So not like medicine, you will get extra, right? So this is pediatrics is much more difficult compared to medicine, right? So you have seven types of short cases. So, and the important thing is short cases, not like medicine, right? So medicine, it is the routine, same. If you are asked to do the cardiovascular system, that is it. So you would perform the cardiovascular system, done. If you are asked to do the lower limb examination, done. If you are asked to do the abdominal system examination, right, done. HRI. But peds, it's not like that. There are so many things are there. For example, if you get a trisomy child with a tetralogy of Fallot, so if you say like there is a tetralogy of Fallot, right? No. So you need to identify whether child is trisomy or not, as well as sometimes some examiners expect you all to tell about this because your command can be do the general and do the relevant. So in such command, you may need to evaluate these all the features of trisomy 21 as well as you need to tell about the CVS everything. So evaluate like it's not like you will not get syndromic children in medicine. But peds, yes, you can get some. So the expectations are right. So there are so many variations are there. And the tetralogy of Fallot, they can have these cerebral abscess, craniotomy, right? Sometimes these VSV, they can have heart failure, right? So they can have a lot of complications compared to medical conditions, which can be evaluated in your this short cases examination. So you are supposed to identify all these things. So the CNS, of course, like for example, if you ask to do the lower limb examination, so the most of the time, like for example, like Ragama exams, like the Punduttapana hospital is next to Ragama, this hospital, so they bring some patients from there. So most of the patients are with spinal cord lesion. So where you will see like you are asked to do the lower limb examination most of the time. So then of course you will see like these upper motor signs most of the time, maybe low motor and with the sensory level, something like that you will see. So here the important thing is peds, it's not like that. So if you get someone like a quadriplegic child, if you after doing this lower limb examination, if you just say cerebral palsy, definitely that you will get failed the exam. Right? You need to identify these what is the type of cerebral palsy, with the anatomical type, the functional type, as well as all the complications, right? So they can have multiple complications where you need to evaluate everything. So you need to evaluate everything in a very short time because you don't get extra time in peaks. So it is very, very much difficult compared to medicine. So what we have practically seen is most of students are focusing mainly on medicine, right? Compared to other subjects. But the reality is like PEDS is very much difficult as well as there are a lot to learn comparatively. So make sure like you study because the expectations are also high. At the same time, the medicine, if you if you keep the patient and if you ask to these respiratory system, if you ask the patient to say anuname, you can they will say anuname. If you also take a deep breath, so the PEDS, can you do that? If you get some like an infant, no. If you get a toddler, sometimes they might not be able to say anuname. The examination method is different. Right? If you get a trisomy child, when you try to keep your stethoscope, will they allow you to keep the stethoscope? Yeah, not. In a neonate cardiovascular, if they start to try, So will you be able to hear this murmur? No. If they start to cry, will you be able to palpate these abdominal organs? No. There are so many tricks, so many practical methods. So you will, like, if you don't learn these problems, you will face all these practical problems in your exams, right? So that's why learning these things is extremely important. So go one by one, and you will need to learn. So here the important thing is there are so many conditions are there, so many variations are there, as well as the expectations are also high, as well as these patients are also comparatively difficult. So the peaks, you need to put a lot of effort, right? And you need to study more. That is extremely important. So here the important thing is, guys, that you need to learn all 7 things. Sometimes how many people have got development last time? So many. Right? Previous time rank 2 again got development for the final at Peradini, right? Yeah, she practiced development assessment in hospital with me. Ekamawa exam, right? So she was so convinced. So she rank 2 last time, not this time, the previous time. So the development assessment, the neonatal, yes, last time do not, yes. So the sometimes Ragam faculty as well as these, especially these Batiklo station, they frequently give this neonatal examination, right? So that is yes. Miscellaneous. So is there a component called miscellaneous in medicine? No, but it's yes. Miscellaneous means what? So you can get anything almost. So it could be like sometimes we might give 2 miscellaneous cases, right? Some short miscellaneous cases, it doesn't take much time. So sometimes skin condition, maybe a rickets, right? So skin condition can be HSP, scabies, eczema, papular urticaria, anything is possible, right? So sometimes it could be right neurofibromatosis, something like F1 spots, right? Sometimes case can be rickets. Sometimes right Marfan's child maybe tried, right? So many things are there, right? So there are lots of them. So the miscellaneous is there. So again, it is very favorite in particular as well as some other stations as well. I can remember even this. At LRH last time for the repeat batch local proper exams. So they didn't want to give this miscellaneous station, but they couldn't find proper cases with classic science for the repeat batch on day 2. So what they did was they gave the approximately there were enough nephrotic children were there with all these Cushing signs and everything. So they gave these nephrotic child do the general and the do the relevant and everything. So child had CKD features as well as the Cushingite features as well as the gross edema nephrotic related. So there are so much to evaluate, and like you need to tell everything, evaluate everything rationally and need to present. It's not easy. It's not easy. Even if you don't learn the things in a proper way, right? I am well aware about what is exactly happening because the reason is one thing is I had very good marks in my exams. More than that, I like throughout my career, I was in these main teaching hospitals, right? And most of the time I was attached to these professorial units as well. So I'm well aware about what are the expectations and right. So that is there. I was always there. Jayavardhanpura, Ragama, LRH, right? So once I went to Gampa, that is the only thing, right? I have never gone to any remote areas, right? Previously. So here the thing is, so I'm well aware what is necessary and what are the exam pattern and what are the expectations and everything, right? As well as I have joined as examiners also in some final exams as well, right? But I don't like for the ER team, it's not ethical and nice, so I will not join, but I know what is exactly happening. So here the important thing is, guys, what? So the short cases, right? So here the important message is, so learn the things in rational way. So here, so what is the first thing is I have asked you all to cover the CVS. So the CVS, the important message is, guys, what? So CVS. Then if you ask from your seniors, what are the cases you have got? 98%, 95% of the students will tell they had at least they had a CVS case also. 90% of the students. right? ඒ කියන්නේ දෙකෙන් එකක් CVS එකක් හම්බ වෙනවාමයි බහුතරයකට. So the most important thing is CVS. So your exam station will be like this, right? So they will be keeping so many beds. එහෙම ward එකේ we will keep they will be separate cubicle. They will be several beds will be there, right? Several beds will be there. So we will be putting several patients. But there will be several CVS cases, right? Then CNS, then the abdomen, SP, maybe development, we again keep that here, right? So what happens is like most of the time they will select a CVS case from most of the candidates examples, right? So CVS is the most important thing, but don't think that CVS is just CVS. So it includes all the syndromes as well. The mainly these trisomy 21, right? Undergraduate level, you need to get perfect in trisomy. So we might ask you to do general and relevant, or maybe we might ask you to do the cardiovascular system. So some child might have associated trisomy 21 features as well. So then, right? So you need to evaluate, right? Good. So here the important thing is, guys, what? So, right. So trisomy, right? Okay. So here the important thing is that's the CVS, the introduction for the short cases. There are tricks are the introduction and tricks for the short cases. So there are tricks are there, and these CVS, the history, the examination technique, then the presentation, then the evaluation, then the coming to the differential diagnosis and the discussion, everything will be there, right? So second day, the third day, the syndromic, trisomy and the related discussion and everything. So that is the most common case which you get. You need to get 100% perfect. That's why CVS requires 3 classes, right? So if you learn, you will understand why it is necessary once you join, right? So that is important. Then the next important thing is, guys, the next thing is CNS. CNS is the third, nowadays, the third commonest case which you get in your exams. Previously, it was the second commonest. But now we are giving a little bit more abdominal cases because most of the students, candidates get screwed up in CNS once we give a CNS case, right? Even though this is the easiest, right? So here the important thing is you need to learn CNS very properly. So the CNS, of course, guys, what? So that is the second important thing which I ask you all to cover next, because that is the most difficult for most of the candidates, right? So the CNS mainly includes cerebral palsy. But at the same time, you might get the cerebral palsy. I think so many variations are there. So it could be quadriplegic, it could be diplegic, it could be hemiplegic, right? Again, the quadriplegic patient can be spastic quadriplegic, or maybe atherotide type, right? Atherotide cerebral palsy also possible, right? So those are the common cases you get in your exam. So you need to get perfect in CP. Out of CNS, 80% of the CNS cases would be CP. Right? Almost 85, right? 85% will be CP. But in addition to that, there are so many other CNS cases are there. You can get hydrocephalus, you can get neural tube defects, you can get Duchenne muscular dystrophy, or you can get maybe other peripheral loss and neuropathies, or maybe cranial nerve palsy. So many things are there. So you need to learn the technique. You need to learn this presentation. You need to learn these, differential diagnosis, right? Everything. And finally, you need to the discussion and everything. So again, CMS to cover all these things requires 3 classes. So once you learn those things, you will get perfect, right? So that is the important thing. So then the RESPI and GI for both, you only for RESPI 1.5 classes, GI 1.5 classes. Again, altogether 3 classes. So the development, neonatal, and the miscellaneous, again, altogether 3 classes, right? So that's how it goes. So basically, you need to cover all these things, because I can't take if you cover only CVS and CNS. Previously it was like that. Some students they say they have joined my short cases, but they have joined only for sometimes only CVS and CNS, or maybe the first grade. Then, of course, when they get a neonatal or development on this, these miscellaneous, most of the time development is very, very common. So when you get something like that, then like they get failed. So that's why nowadays I ask you all to do the full payment rather than like module wise module, because some students they don't join. So it's important to cover everything. So, but there should be an order. So first of all, you need to cover the CBS and CNS. Then, of course, like I will be conducting these online revision and exam type thing, right? That is something a compulsory thing, right? So every 2 weeks, every 1.5 weeks, maybe once a week or maybe twice a week, right? Sorry, every 2 weeks or maybe every once a week, I might conduct these short cases exam, right? So here the important thing is initially you need to cover the CVS and CNS because you need to get 200% perfect, where I'll be putting these videos, various types of aids, like all these patients, I have all these videos, questions and everything, and the practical things, right? So how are you going to approach, the murmurs, sounds, murmurs and everything. Then you need to give the answers and rational things, and by that time, like when I give targets, you will study according to that. So first, like when I give targets, then you see, then you do this online revision session and then you are conducting this specialized unit practical. So you will see enough CNS cases as well as enough, like you will see a lot of serious cases as well. Then you will get perfect. Then moving to the next one, right? So like that. So then we are moving to this like bigger hospital visits as well as starting this mass mix practical like that. So straight away, I don't jump for these hospital visits or mass mix practicals, because if you just come to my hospital, my boy, like if you don't know what exactly you need to do, then like no point. You will not learn anything. It should be always like an exam. When you are coming to my hospital, it should be always like the exam, right? So I'm like, yeah, like you will be given 10 minutes and you need to perform during that 10 minutes and like tuck, 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 and just like the exam, right? So my expectations are very much high if you come to my hospital, right? Hospital in the back, right? That is important. There are like patients, of course, hospital patients, they are ill, and like all these things are free, and like you all I don't want like you all to like just come and like abuse these patients. So I want you all to get the proper knowledge, then you can apply. Otherwise, you all are not supposed to join, right? Okay, good. So that is important. So here the important message is, guys, what? Yes. So then this short cases. So the first of all, online lectures. That is the very first thing which you need to do. Then at the same time, the online practical revision and exams. So that is compulsory, right? That is compulsory. So if you join, you will learn so many things as well as you will get perfect. If you don't join for that, I can't I can't guarantee about your short case results, right? That is the most important thing which you out of like after these covering online lectures. That is the most important thing. Then, of course, there's a specialized unit practicals are there. So where you will see enough patients, like once we cover these after these online practical sessions. So that's why I want you all to join these short cases early. So then we can quickly start these practicals, right? So then the hospital visits are there, but always it could be exam time, right? So I won't do much teaching there. So everything will be just like the exams. I will be only correcting your mistakes. So you can't do hundreds of mistakes. So yeah, right. I can't correct each and every thing, right? So then the mass mix type practical sessions, yeah, you will see everything, right? You will see everything. So last time, I don't know, some of y'all must have joined last time. So for cerebral palsy, how many types of patients are there? So most of they will be you will see hemiplegic, not all these patterns. Isolated lower limbic model, low face and upper limb, face, upper limbs and lower limb. Diplegic who are walking with wheelchairs, who are walking alone, right? The quadriplegic, completely disabled, right? And who can walk. So all these variations, just like looking at a one diplegic CP or hemiplegic CP child, you might not be able to work out. Duchenne muscular dystrophy, various types. right? So you saw everything last time. Trisomies, various types, VSDs, various types, tetralogy of Fallot, various, right? AV canal defects, how are you going to differentiate AV canal defects from it? And the miscellaneous, there is rickets, right? Marfans, right? Or so many things, sometimes achondroplasia, right? Everything, right? So will be there, right? So the neural tube defects, everything, these hydrocephalus, you will see everything there in the mass mix practical, everything, right? So here the important thing is, but it is very hard to conduct, right? I really get exhausted, but I'm conducting. So the mass mix practical is the next important one, right? So the important thing is online lectures, the online practical revisions and sessions. Then you can come to these specialized units and the mass mix practical sessions. The hospital visits are the least important one for short cases, but again, you can come if you have, right, if you have confidence, right? Good. Then the important thing is, guys, what? So yes. Then when it comes, that is the short cases plan, right? So hope you all are very clear. Right, you can see this is the specialized unit practicals, right? So these you will see enough these cerebral palsy, hydrocephalus, trisomies, right? Right, you will see so many patients there, right? And these are some specialized unit practicals, like again these are neonatal exam. This is the cardio. You will see these specialized murmurs, right? You will see all these murmurs there. But again, like everyone might not be able to get the opportunity to go these LR specialized unit centers, right? But again, for this, of course, majority will be able to go, right? Majority, almost like everyone will be able to go to this specialized unit practical. But these are sometimes, right? So sometimes I can't predict, right? It depends on the batch and the confidence and everything. So here, these are hospital visits. Again, you can come to my board and practice, right? So yes, you can get perfect. So again, these hospital visits, right? Again, the mass mix practical, again, very important. You will see almost all the cases. So that is again important. So you can see these are like this is rank 1 student. Again, this is rank 2, right? Again, rank 5. Then this rank 3 student also here. Then here the important thing is, guys, what is the common thing? So these students are really attached, right? So they are they ask, then they actively participate. Were always next to me, and if they find any doubts, they frequently ask and they clarify their doubts. So it is, and they always join these live sessions, and they they improve their knowledge, right? So it is very important to join these things. So actively participate. That is very important. So these are some pictures of mass mix practicals, right? So most of the time, right, that is right. So this is the last time mass mix practical. So you can see. So this is rank 1, rank 3, rank 2. Keep doing like the students who are always around me, usually get right through the exams easily, right? So that's why I'm telling you all to don't hide. So always join actively, join actively, don't hide. And if you have any problems, you need to let me know, right? So then I can help you. So then this is the long case, guys. Long case, these practical sessions as well as this course plan. So first of all, guys, the online lectures and live updates are there. So basically, there will be classes will be there. So the very first class which you need to cover is I'm teaching all there will be there is a separate class is there in the platform where I'm teaching you all about this introduction to the long cases, as well as the next important thing is the febrile convention, right? That is the very first class which you need to cover. The introduction to long cases means, guys, but where I'm teaching you all a very nice template. So you can apply that knowledge to any other subject as well. If you apply that knowledge, I think one student mentioned that, previous student mentioned that. So if you apply that knowledge, you will not find any problem, right, in your exams. So in your long case exam, so you will be able to cover everything, and you can get you can make a nice history, and you can present very nicely. So I am teaching all the tricks to get smart in long cases as well as this template. So you need to cover that first. So then, of course, you can you can get you can like the ministry will allocate some hospitals for you all. So when you go there, you can use that. You can master in that template, and you can apply that to real patients. At the same time, guys, so the thing is, febrile conversion is the one which I'm asking you all to cover first, because that is the most common long case which you get in your exam, right? So even though it is very easy and very short, that is the commonest long case which you get in your exams. And unfortunately, years back, that was the commonest case where the most of the students got failed in the exams. Before I come to this field, what I noticed was most of the students have they have got failed after getting this febrile conversion. Class the students used to come and say, they have gone to some other classes, and they were coming, and they used to say, අනේ මන්ද සර් හොඳට කරා ෆේල් නේ කියලා. අනේ මන්ද හැම එකම මන් දන්නේ මොකද ෆේල්. So then I asked, what is the case you got? The febrile, right? So keep this in your mind. So because even though febrile conversion is very easy, our expectations are very high. And what we have seen is most of the students, right, are giving wrong answers, incorrect answers in febrile conversion cases. So if you don't know the real facts, the correct facts, so then you will get failed in the exam. So that is the reason you get failed in the exam. So have you then on failed? So that is the reason. So our expectations are very high. So I want you all to cover that introduction and the febrile conversion first. Then you can cover the rest of the things, right? So then nephrology and everything, right? You can cover. So here the important thing is I'm telling you all what are the important ones. I'll be teaching all what are the first line cases, second line cases, the third line and the fourth line. So of course you need to cover first line, second line, third line, everything, as well as fourth line also. But you will get 95% of the time you will get one out of first line or second line or third line cases. So right, you will have main 11 cases will be there. So you will get one out of main 11 cases, but there will be rare, little bit less common. Another 10 cases will be there. So I strongly advise you all to cover everything because sometimes so if you ask some students last time also, they have thalassemia, right? I'm teaching everything for the long, everything is there. So if you can get fail. Some years you can get hemophilia. Sometimes some students can get ITP, right? So you need to get prepared for everything. So you need to cover. But I want you all to master and cover the first level cases quickly, so you can keep on practicing with me. So then if you have some idea about the rest of the cases, then you can get through the exam. So the first 11 cases, our expectations are very high. If you perform poorly, so then of course there is a high chance of getting failed in the exam. So here the important message is, guys, what? The long cases, again, not only these things, sometimes in the discussion, they might ask few things about immunization, maybe anemia, little bit, maybe about the failure to thrive. So you need to have a rough idea. Again, everything will be there about everything is there in the platform. So you cover the lectures, everything early as and much as possible. And I want you all to cover early as possible. So then, guys, the long cases training. So the long cases training, again, guys, it is very important. So I will be training you all. As I mentioned, almost every day, right? So 3 or 4 days per week. Like I will be discussing morning and evening. So whenever I get free time, I drop a message. So you can, if you all are like, so most of you all are not doing any jobs or any other thing. No? So you all can join and you can discuss, right? So, but for the discussion, it's very important to cover the things, right? So to cover at least febrile conversion plus at least few long cases. So you can keep on practicing with me. So you can get mastered in long cases and you can correct down your errors. So the important thing is, guys, what even how much you take histories in your like separately in your hospitals, that won't help you much because you won't be guided by a proper teacher, right? So some students are telling mang andurna kenek inna me hospital ekේ. So some are going, but they are not well aware about the ERPM setup, right? So that is very important. So some students like ministry එකේ මට මේක දුන්නා hospital එක මම මේකට ගිහලා ලෙඩ බලනවා. මං යාළුවොත් එක්ක present කරනවා. That is good that you can do that. But again, that won't make a huge difference. So it is the most important thing is practice in front of me, right? So the practice much as possible in front of me, then you will get perfect. The long cases are the most important. So if I notice that you are comparative, like you are not up to standard, then I will, like I'm giving you, like I will be giving like more individual attention as well as extra support, right? So make sure you practice and you join all these sessions. So then, guys, then the hospital is it again. The thing is, when you come to my hospital again, it will be again just like the exams. You will get real patients as well as like you need, like you are getting 10 minutes. You need to take the history within 10 minutes and you need to present, right? And the discussion again another 10 minutes, right? So again, my expectations are very high. Make sure you get mastered in long cases also before coming to us. So then the long cases live exams, again, that is extremely important. So you will have all the stress and everything will be there. So if you scored, that is one of the most important session. So if you scored more than 60, definitely you will get through the exam. Even if you have scored more than 50, yes, you will get through the exam. But if you have scored less than 45, there is a risk. So you require additional support and training. So don't hide if you have scored less than 45. So always, right? So after that, like participate more actively, and as well as whenever I'm conducting these live sessions, you need to join, right? Good. So then this is about long case exams. So you will learn so many things, right? Good. So then this is yes, right. So again, the emergency Viva, again there are online lectures are there, so you need to learn everything in detail. So it's not so easy, right? So they will be given a case scenario. So what happens is, like most of the time they will be given a case, right? So Patum, are you there?
Yes, sir.
Right. So it's like this. So for example, now for example, Ragama course, it's like this. ඔගලන්ගේ වාසනාව ඔගොල්ලෝම තමයි උරගා බලන්නේ. Right? එතකොට කොළ කෑලි වර්ගයක් තියෙනවා. So you need to pick one. And you need to give it to the examiner. So they have mentioned a case in that thing, right? So for example, like then of course, what they do is they will recall a real case, what they experienced in recent past. And they will tell you a case. That's what happens. ඒගොල්ලෝ කියන්නේ tell me the management of bronchial asthma, severe acute exacerbation of bronchial asthma. They won't ask you all to say the management of status epilepsy. They will say something like this. So for example, there's a 4-year-old child had abdominal pain and vomiting, and suddenly vomiting and brought to the hospital. On admission, the child's DCS was child's GCS was 12 and the respiratory rate was 80. But the lungs were clear. And child was significantly dehydrated. So then they will ask, so how are you going to approach? And like, make a case, this may be your, this might be my case. Sometimes you might get, sometimes may not. But you need to approach in a very rational way. So, Patum, do you want to try?
Yes, it's DK is my main diagnosis that I'm
Very good,
working
excellent.
on.
Very good, excellent.
Yeah.
So here the one thing is like, so some of you all might be able to get the diagnosis, some may not. But you may need to like, this is like a DK, right? So then of course you need to go like, first of all, I will manage the RV breathing circle, blah, blah, blah. Then of course I will do a capillary blood sugar. Can I know the value? Right. So we might say 680. So there is an obvious hyperglycemia. So I will check for enduring ketone bodies as well as I will do a VBG. Can I know the VBG value? pH is 7.1, bicarbonate is 5, and the partial pressure of carbon dioxide is 20. Right. So we might say some values. So this is like a severe DKA. So we will kind of like it's like that. So some cases are like that. Sometimes like they might not give you like enough clues. So here the important thing is like, for example, I will tell you another case. There's a 2-week-old child who had poor feeding and vomiting. And on admission, child was very lethargic, right? And how are you going to approach? 2-week-old child, right? The previous birth history and was uncomplicated antenatal and birth history was well child, and 2-week-old child presented with vomiting and on admission child was lethargic. So how are you going to approach? So yes, Patum, do you want to try? What are you going to do?
Okay, I will just go ahead with the usual thing. First of all, I would like to manage the airway breathing and circulation, try to see if those are stable in the patient. And since the patient is already drowsy, I would like to check a CBS and capillary blood sugar.
See, දැන් පැතුම් තාම Viva start කරලත් නැහැ, right? Like Viva start කරලා කියන්නේ not the, I don't think like you started this emergency, but see like tuck, I want these like house officers to be like this. Tuck කරලා කියන්න ඕනේ, right? So like tuck. So he asked first, he did the CBS. Since the child was lethargic, very good. So CBS was so what are things? Then we might ask a few questions. Okay, airway breathing was normal. What are things you are going to assess in the circulation? Patum? Hi there.
So give me a second. My connection is a little poor. Okay, I think I got the last part of the question, sir.
No, the airway breathing was normal. What are the things you are going to assess in the circulation?
So sorry, sir. My connection is.
Yeah, it's okay. It's okay. Circulation. What are things you are going to assess? Any idea?
In the circulation, yes.
Yes.
Okay, so one thing I would like to check is the blood pressure is something I would like to see. Then the pulse rate is something that will give me a clue about what's going on. The pulse as well as, I mean, not just the rate, the pulse volume as well as the, I mean, if the pulse volume is quite low, then maybe it might be dehydration.
Yes. Okay.
Also,
wait. Okay. So the pulse rate was 180. The pulse volume was very narrow, thready pulse, and the capillary refilling time was 5 seconds, and the blood pressure was 50 systolic. The diastolic was unrecordable, and you did the capillary blood sugar, and capillary blood sugar was 20 milligram per deciliter. So, how are you going to manage? Any idea? So basically, like there's a circulatory collapse as well as there's a low hypoglycemia is there. First of all, of course, you need to give a IV, insert an IV cannula and draw the blood for the investigations, right? Full blood count, VBG, serum electrolytes, and these the septic screening and everything. And also you need to give the fluid resuscitation where you need to give an 20 ml per kg rapid bolus and reassess the circulation. At the same time, you give an dextrose, 10% dextrose bolus followed by an infusion, right? So you need to tell the doses, right? 2.5 ml, sorry, 5 ml per kg, 3 ml, 2.5 ml per kg bolus followed by an infusion. So then, what do you think? Now the child improved, circulation got improved. Now the pulse rate got reduced. The blood pressure is normal. Capillary refilling time is normal. Now the CPS has picked up to 102. What are you going to do? Now what are you going to do? What are your differential diagrams? Anyone? Lasita? Any idea? එකපාරම දැන් මොකද්ද මේ වෙන්නේ කියලා දැන් සීනියා අඩුයි hyperglycemia ළමයට මොනවද වෙන්න පුළුවන්? One thing is it can be sepsis. So when they have sepsis, they can have vomiting, they might unable to feed, they can have hyperglycemia as well as septic shock. The other thing is they can have poor feeding itself, lamma kiri pola naha, they can have hyperglycemia, but getting these hypovolemia is less, hypertension is less common, but again still possible, right? What is the other thing which you need to think? This is a 2-week-old boy. This is the other one. Anyone? Any idea? Come on, guys.
Pyloric stenosis.
Sorry?
Pyloric stenosis.
Pyloric stenosis, again, good. So most of the time it occurs initiate around 6 weeks. But again, yes, pyloric stenosis and vomiting, dehydration, yes, that is again possible. Yes. Yeah. Very good, Mirage. So congenital adrenal hyplasia. So downset can be around 2 weeks, and the vomiting and the hypoglycemia and the hypertension. So this is a boy. So what are you going to check then?
We'll have to check his genitalia.
Yeah, you need to check the genitalia whether there is an hyperpigmentation, right? So if you notice there, so that's a huge clue. So what can you do if you have slightest degree of suspicions? What can you do? You can give IV hydrocortisone, right? So then of course right, so then of course there are so many things are there which you need to discuss. So they initially you might not have enough clues to come to the conclusion, but the DK one it is more towards almost all the clinical picture is likely DK, what I mentioned. But sometimes CH child you are not, you can sometimes it may be little bit difficult to come to the conclusion at the beginning, right? So it's a different art and it is a different method. It's not easy. So sometimes they don't stop there, right? So for example, now the thing is they might say child had an fear for 4 days and suddenly came with a convulsion and convulsion was keep on going. So how are you going to manage? So you might say status epilepsy management. Then after that, of course, they might switch to now the conversion got settled. How are you going to manage? So the CRP is 280, and this what are the examination things you are going to visit? The student there's a neck stiffness and I'm going to the neck stiffness is positive and the photophobia was there in the history when you are evaluating. Yes, then how are you? So they will ask the meningitis management. It was when you are giving antibiotics, the child suddenly develop a rash. And what are you going to do? So then you need to tell our rash. So I will evaluate the rash as well as I will assess the circulation as well as the respiratory and these things. I thought here blood pressure is say 60 by 30. So then of course I must have gone into anaphylaxis shock following these IV antibiotics. So then how are you going to manage it? So it's like that. So they might ask taking DK management they might say suddenly child now GC is initially improved, now suddenly started to deteriorate and the blood pressure was increasing, but the pulse rate is reduced. So anything else you want to examine? So then you need to say, I will check the fundus for the papillary edema and the exaggerated reflexes. So the reflex, so they will say exaggerated reflexes are there. Then the fundus, there is a papillary edema. What are you going to say? So this is about cerebral edema. So how are you going to manage the cerebral edema? So it's like that, right? So the emergencies are again not easy, right? So you need to get perfect. So they are everything, right? Everything. So I can remember like the last time we said these Colombo station, right? The hypercyanotic spell, they asked like for some students like everything, all these minute mechanisms, Nietzsche's position, the Kuhama workout vela make a hariyan, right? Everything they ask. So tell me what are the other complications? How they develop cerebral abscess? How they develop gout? Why do they require? How are you going to prevent these thrombosis? Right. So everything they ask. Right. So the thing is, it's don't think that this is easy. Again, like ඔගලන්ට exam එකට ගිහිල්ලා එන්න පුළුවන් like එන්න පුළුවන් අයියෝ කිව්වා ඉතින් ඒ වුණාට සමහර ඒවා නම් ඉතින් දන්නේ නැහැ exam එක නෑවුව මම දැන් මේවා නම් ඉගෙනගෙන තිබ්බේ නැහැ කියලා. එහෙමත් එන්න පුළුවන්. නැත්තම් කොහොම ආනහන එකට ඔක්කොටම උත්තර දුන්නා දීලා මේ. Right? So it's like that. So here the important thing is, guys, what? Learn the theory facts very correctly. Don't think that these Viva exams are easy. So here. So I forgot to tell you all why you need to get through the Viva exams. So here the important thing is, guys, what? Very important message is, guys, what Viva exams, you need to get through the very first attempt. That is the most important thing, right? Viva tournament, everything, if you have got through these theory also in one shot, then of course definitely somehow make sure like you get through the Viva also in first shot, right? So that is very important. So even if you are, how much you are bright, if you screwed up in one exam and if you got failed, then of course you will not be able to get a good rank. And you will not be labeled as a bright student. Right? So I can remember there was an but she, I think, didn't join. So here the thing is, like, you know this I'm not going to tell the names or this. So that there was one student was there. The knowledge is good, but she's not super smart. But her communication skills are extremely super. So then, but knowledge is average. But these things are like the communication skills are extremely super. So she joined my Viva. She followed the instruction, followed the courses. So she gained the proper theory knowledge. So with her communication skills, the theory knowledge plus the super these communication skills, so I knew that she can get a very good these marks in her exam. So she got the LRH station, and after the exams, all the examiners were talking about her. Right? So they were so impressed. So she had like marks more than anyone for each and every component. So more than 95 for these for each and every component, long cases as well as both short cases. Right? So the important thing is, she just after the exams also she ran, like she came to my ward also and came to thank me. So the examiners were so happy, satisfied and everything. So like she was so happy. Then I said, make sure you get through the other exams also, like definitely, because then you can become rank 1. So with this mark, if she has got through all components, she will definitely get through. Like she will definitely get to rank 1. But unfortunately, she has got failed in one major subject in bio. Right? Probably hasn't learned the theory facts correctly. I don't know. In that particular subject. So what happened was, like there were so many other students there, right, who had less knowledge as well as very much less communication skills and the less knowledge, but they were able to get through the exams and they had very good ranks and they were able to go start the internship. But she could, right? Rank 1 and right? So here the important thing is each and every year they will like VIC, one of my favorites and the student, one of my listeners who get failed in some other subject, unfortunately, right? So make sure, right, to get through the exams in one shot. That is very important. The other important thing is next time. So you must have heard. So even this time, the rank one has got Anuradhapur. That's a good hospital, right? Teaching hospital. Rank two also has gone to Anuradhapur. So, but last time, previous time, they were second attempters there who were working at LRH Medical Board, right? So even one of my house officer also a foreign graduate who got through in her second attempt, right? So it depends on the batch. So next time the advantage is, guys, there won't be any local proper batch. The local repeat batch will be there, right? So since the NHSL is for the repeat batches, the NHSL's medicine surgery will not be there. So most of these repeat batch students are applying for these remote areas. So you can easily get the Colombo station next time. So Castle Hospital, Finchek, yes. Okay, again, the important thing is KU. Previously, like the proper batch will be there with the local repeat batch. But this time, again, no item students, they have finished. KU also, they will be only a repeat batch. So if you get through the exams next time, it you can get whatever the station you want, as well as it's not only about the internship. It's about the RHO period as well as your MO period, right? The post internship, right? So the RA, some students actually they go very remote areas, right? Like thinking about doing medicine and everything. Finally, they don't get medical appointment as well. At the same time, then the RHO period also they need to work in those remote areas. At the same time, like the MO period, the first initial SHO the appointment, you are getting some more remote area, like it would be a very much difficult station, right? But if you next time if you get through the exam, right, you can stay around Colombo or whatever the station you require, right? Not only during your internship, even after that. So that's right. Make sure you get through the exams. Definitely put your maximum of it. සමහර අය හිතනවා අයියෝ Viva classes මේවා වියදම් යනවා, සල්ලි යනවා, අනම්මනම් වෙනවා කියලා හිතනවා. So the thing is, එකපාරක් attempt එකක් නැති වුණොත් you are losing more than 25 lakhs. Right? You will not understand today, but you will understand later. Just with the government salary. You will not understand the concept today, but you will understand later what I am telling you. Right? It's just 6 months. Right? Make sure you make sure. But again, the thing is, some students are there who have economical issues. So if you have serious economical issues, you can let us know. Right? We will help you. Right? But the thing is, make sure you join in power the things early and much as possible. Put your maximum effort and make sure utilize your time. Every second counts. Right? So the thing is that is important. So cover the things early and much as possible and master it. Practice again and again and again and again and again and make sure you mastered in all these components. Right? Good. So then guys, that is about these Viva. Again, you need to get through the exams. Then guys, give me a second. Yes. So again, in emergency Viva online, again in addition to that, I will be conducting these live exams with practicals and updates, right? So that will be there. And again, these are some these Viva exams which I conducted, right? These emergency exams. So here the important message. What is this? So guys, Paediatrics EC program is like going in a roller coaster, right? So you can see these top rankers. They actually got into this roller coaster. It's like getting into a roller coaster, as I'm telling you, right? Make it a lamai. ඔගොල්ලෝ එළියේ ඉඳලා දකින්නේ සමහර ළමයි roller coaster එකට යන්න ආසයි, නගින්න ආසයි.
ඒක ෆන් එකක් තියෙනවා. සමහර ළමයි මොකද වෙන්නේ ළමයි? රෝලර් කෝස්ටර් එක දැක්කම අම්මෝ කන බයයි. right? හැබැයි සමහර අය ඉන්නවා එහෙම සමහර නගින්නේ. පොඩ්ඩ දෙනෙක් ඉන්නවා මේක නගින්නේ. right? හැබැයි සමහර අය ඉන්නවා බයෙන් මේ බයයි. නැගලා ඉවර රෝලර් කෝස්ටර් එකෙන් ගිහිල්ලා ඉවර වුණාට පස්සේ මොකද්ද ෆීල් වෙන්නේ? වාව්! ඒ වගේ thrill එකක් කොහෙවත් නැහැ. ඒක තමයි maximum fun එක. So ආයෙ පුළුවන් නම් ආයෙ රෝලර් කෝස්ටර් එකේ නගිනවා. ආයෙ ඕනනම් ආයෙ රෝලර් කෝස්ටර් එකේ නගිනවා. right? හැබැයි රෝලර් කෝස්ටර් එකේ නැගිටින හැටි එක්කිනාට ඔක fun එක thrill එක තේරෙනවද? Yeah, that ඉන්නේ ඒක බය විතර. So it's like this pediatrics easy program is like that. I know some students are here also, like there are some students are there who are very scared to get exposed. So they don't present, they don't join the live sessions, they will keep on hiding. They never communicate with me, right? So then of course, like the thing is, guys, you will not see this fun as well as pick up ප්‍රශ්නත් තැනින් අහනවා මේ. ඔයගොල්ලන්ගේ මම දැන් මම පැතුම්ගෙන් ඇහුවේ වැඩිපුර because I know that he is capable of giving some answers. මම එහෙම නෝට් කරන අයගෙන් තමයි වැඩිපුර අහන්නේ. එහෙම නැත්නම් මම ඔයගොල්ලන් පල්ලෙහාට දාන්න එහෙම අහන්නේ නැහැ. right? ප්‍රශ්න මොනවා හරි එකක් ඉතින් උත්තරේ දාන්න නැත්නම් දාන්නේ නැහැ. ඥානෙ තියෙනවා. right? ඔත් එහෙමයි. ඒක එහෙම ප්‍රශ්නයක් නැහැ. It's the training part of your training. right? So here the important thing is live sessions I might ask questions, but again the thing is like you can decide. You can join in at Viva is all about the communication. Right? Without discussing, without talking, you will not be able to get through the exam. So you need to somehow get into this roller coaster. Then you will realize this how much is fun. Right? So you must, if you inquire from your seniors, you will, I believe, right? Most of the students will say their favorite teacher is me. Right? What is the reason? It's a roller coaster එක තමයි. මේක බයෙන් ගිහින් ඉවර වුණාට පස්සේ මේවා. මොකද මම වගේ සමහර වෙලාවට මම ඒ වගේ මේ live active sessions දාන ඒ වගේ මම closely ඒගොල්ලන්ට individually ඒ කියන්නේ ඒගොල්ලන් like help කරනවා for everyone. I will make sure like none of my students get failed in the exams. Right? So that's the reason like students are attached. හැමෝම attached. You can exams like I think like what I have seen, right? Most of the students actually come ඒගොල්ලෝ pay කරලා මට ආයෙ තැන් කරන් දෙන්නවත් මොකුත් ඕනේ නැහැ. nothing. I paid already. නම් ගොඩක් මට attach වෙනවා. ඒගොල්ලෝ හැමෝම ඇවිල්ලා මා ඇවිල්ලා කතා කරලා සමහරට ඇවි බෝලක් දීලා මේවා කරලා මේක සමහර වෙලාවට අනිත් teachers like මේක දකින්නේ නැහැ. The reason is guys, because the program is like going in a roller coaster, right? So and they really get attached after that. So thing is because I'm helping also at the same time, it's like looks scary. But if you don't in such way, right, it is hard to get through the exam. That is the reason the out of all these Viva programs, so that nowadays the pediatric has the highest pass rate as well as like I have the highest pass rate. Like it's not pass rate very more out of all these subjects, right? Whether you like it or not, right? So you can, right? You need to expose, right? You need to discuss. You need to talk. Like whenever I'm conducting these live sessions, right? Good. So that is important. So don't hide. That is the most important message which I need to tell you all, because otherwise I will not be able to identify your weaknesses and I will not be able to help you all. So like after the exams, I discuss with each and every student who got failed in the exams, right? Mage classes මොනවට හරි join වෙලා fail වෙච්ච ළමයි එක්ක. So there were 7 students there who haven't joined my long cases. Everything කරන්න බෑ long case course එක join කරන්න. We have joined my long cases as well as short cases, but all these 3 students they didn't come for my long case exams as well as they never joined for my these long cases discussion session.
So here the important thing is if you join the Adena, right? Because you join right? Regular join so if you join the teams class. Right? There's magic. There's no any other magic. Learn the things in a get the proper theory knowledge as well as right join these live sessions. Then you will get the right. Clear? Good. So here the important thing is, guys, are so you will be happy after everything. So you can get the top ranks, and you can see all are very attached with me, right? So here the important thing is, guys, are okay. This is some like they are very attached. This is say Kingsbury. Sorry, Water Edge කට්ටිය දුන්න පාට් එක. මේක Kingsbury එකේ දුන්න එක. මේක Cinnamon brand එකේ. then again මේක Galadari එකේ දුන්න පාට් එක. So right ළමයිම organize කරලා දුන්නා because like they were very happy, right? So that is the thing. So here the important message is, guys, that so the reality is, guys, that the ERTM exams are extremely easy. The pediatrics is easy. So you can have a wonderful internship as well as even after that, right? So guys, I hope you all are very clear about our program. So any questions, guys? Yes, any questions? Anything to ask? Perfect. Okay. Right, guys. So here the important thing is like now again the thing is, guys, I think most of you all have joined my Viva classes. I think more than 100 students have joined already. So I think here the thing is for the Viva course. So for the others also, I'm telling you all to join early as possible and much as possible. Again, don't wait till the results comes. So here the important thing is because like when you get the access this time again, when you're joining again, you can get the access again, right? But there are two important things there. So most important thing is fill the Google form, right? There were one or two students there who haven't, I don't know, they were telling like they have joined previously, but they don't have any evidence, right? Hasn't filled the Google form as well as no tips or anything, not in any of these groups. Then of course we might not be able to help you out. So make sure you fill the Google form, then we will have this database. So that is the very first step. Then the important thing is, guys, are the cover the short cases quickly. So here the important thing is you have 4 subjects, right? And 6 types of exams, including these emergencies. So here the important thing is, guys, what it's not, don't take it in a wrong way. It's not because I'm doing peaks, right? So I usually strongly advise you all to cover the pediatrics early as much as possible, right? The reason is, as far as I know, some like compared to some, as far as I know, compared to some other subjects, I am conducting more live and practical sessions, right? So because of that, so if you have covered the things early, so you can apply that knowledge during these live sessions, right? So that is why I am asking you all to cover the things early and much as possible. So here the important thing is, I am giving you like 2 weeks to cover the CVS and CNS, right? So not next Sunday, the week after, I will be conducting an exam type session, right? The online session where you all need to study. The registered students need to study the CVS and CNS, everything. So I will be giving videos and the discussions and these cases and everything. You can ask from your seniors how important it is. So it is the 2 important things are there. Since you need like you will get prepared for that. Then when you get prepared, you will get perfect. Then at the same time you will see all these the variations and everything, right?
So then the discussions and how the variations comes, the practical approaches, everything, right? ඒවා කියලා දෙන්නේ practically එන problems ඒවා settle කරන ඒවා ඒකෙදි තමයි කියලා දෙන්නේ, right? So you need to join, that is compulsory for registered students, right? So join that, and like I want you all to cover. At the same time, I want you all to cover this long cases, febrile conversion, and this introduction, at least that, right, this week. Then if you have time, start with nephrology or CNS and cover, because CNS and nephrology have like are the common, like you will get into so many long cases. So try to cover the things early and much as possible. So from 17 onwards, I will be making a separate group for the long cases. If you have registered, then if you all are ready, you can join for that. Then I will be each and every time I will be putting these messages, and I will like whenever I'm getting free, and you all can join and you can like actively participate. So I will be pretending like a real, I'm imagine an exam real case, and you will be taking the history as well as going like the exams and the discussions. So ඔගොල්ලෝ පාඩම් කරලා නැති එකක් randomly මන් දෙන්නේ නැහැ. That's why it's like gradual thing. So the very initially I will be discussing the febrile conversion as well as the nephrology initial and the CNS one. Move into the next month, right? So it's fine. So here the important thing is cover the much as possible, so you will get perfect and get mastered in both short cases and long cases. Initially, of course, I was doing these short cases first, and I took little bit time to start long cases. But again, I thought of starting the long cases also parallelly. The reason is that is the most important thing, where like most of the students actually get failed due to these long cases. So you need to get perfect and mastered in long cases, because long cases discussion, like short cases, of course, like when you say some differential, then හිතන්න merm එක එන prominent එකක් යනවා නම් serious එක common වෙන්නේ. ඔයගලන්ට commonly මේ exam එක හම්බෙන්නේ VSD or top. So cyanotic නැද්ද cyanotic එක short case එක කොහොමද ටිකක් ගොඩ දාගන්න පුළුවන්. Right? The abdomen, then the abdomen. මොකක් හරි අහුනේ මේක මොකක් හරි, like if you have practiced the technique and say some differential diagnosis or DDs a little bit rationally, okay. So there is no much. But the long cases, it's not like that. Right? There are much to learn. Especially if you haven't joined my theory previously, probably you might have a very poor knowledge, the practical what I have seen. So the thing is, but don't worry, even if you haven't joined any of my theory or these Paediatrics, you will learn everything what is necessary in these long cases, these course, right? So you will learn everything and you will get perfect, right? So that is the plan and everything. I think we discussed enough, right? Right. So any questions? Any doubts to clarify? Right. So yes, if you have anything, you can stay, and so I'm not going to discuss today much about the CES and everything. Everything is there in the platform. So I don't think like I need to demonstrate how I'm the teaching and everything. So I think after joining this Paediatrics, I think all of you know about my teaching pattern and everything. And with those days, I used to conduct these CBS thing previously, like with the initial class. But because in some were not aware about my teaching, then nowadays I think almost all are aware about my teaching pattern and everything. Your seniors must have told, and there are some YouTube videos are there. But again, like you will get more interest even more than this Paediatrics program when you join this Viva, right? So the thing is, guys, I'm not like everything is there in the platform. So cover the short cases early and much as possible, right? Cover the CES and CNS next 2 weeks, as well as cover these long cases also. If you have covered already, that would be like really good. So the thing is, next 17th onwards, I will be starting long cases discussion, right? Good. So if you have anything, you can stay and ask, guys. And if you have any doubts, you can contact me as well as my coordinator. I think you all really like this new coordinator. She's good, right? She's very supportive and helpful. So You can contact her as well as related to these IT stuff as well as these platform stuff. And also you can contact me at any time for these academic stuff. And just in case if I'm busy, I will give you a free time. Most of the days, like the morning hours, like I'll be able to discuss with you all, right? So you can call me, clarify your doubts, right? So then we'll stop for today. Hope you had a great time. So hope you had a very clear idea about the Viva plan. So utilize your time. Every second counts. Don't think that you have a lot of time. So these like small things make your life completely change your life, right? So මුළු ජීවිතේම වෙනස් වෙනවා ඔයා ගන්න පොඩි තීරණ වලින්, right? So utilize your time and think smart, right? And spend your time and money wisely, right? පස්සේ අයියෝ සල්ලි පස්සේ අයියෝ කාලේ අයියෝ කියලා කියන්නේ, right? So spend your time and money wisely. So then we'll stop for today. So then guys, I will see you soon and I will update you all. So I will see you all on 17 onwards. So then see you. Have a nice day. Good night.
Thank you, sir.
Thank you, sir. Thank you, sir. Thank you, sir.
Thank you, sir.
Those who have questions, you can. Okay.
Thank you,
those who
sir.
have questions, you can stay and ask. Any questions?
Thank you, sir.
No questions. No doubts. So hope you all are clear. So if there's anything